CNN recognized her as one of their 10 2021 heroes. But more than that, she is a hometown hero. I cannot think of a more deserving recipient of the Praxis Award. It is truly my honor to introduce Dr. Ala Stanford as our 2022 Praxis Award recipient.
So have a seat.
Oh, have a seat?
No, and you stay here. Okay. So, so there's an honorarium that comes with this, which I think you probably already received.
Okay.
I wanted to give it to you today, but our bursar's office decided to send it to you. But we're also going to give you this keepsake. It's got Villanova's logo in the name, and it reads, "The Praxis Award in Professional Ethics, Dr. Ala Stanford, in recognition of her commitment to professional integrity, presented this 7th day of April, 2022, the Ethics Program at Villanova University."
Thank you.
So,
Oh my gosh.
I have a box.
We have to take a picture.
You want to take a picture?
Yeah. My husband has it.
Please take a picture.
Yes. Are you taking a picture of me? We can also do it later. Oh, okay. Wow. Good afternoon, everyone. Good afternoon. Thank you, Dr. Bennett. My goodness. Not supposed to be crying already. I just started. You would have thought that we have known each other forever. But I feel like I know you, and thank you. Thank you for nominating me. Thank you, Dr. Dorley, for being such a gracious host, inviting me to spend some time with your students, which I truly enjoyed this afternoon. They asked so many thought-provoking questions, which really prepared me for my presentation. I think I changed some things based on our conversation. Father Donahue, thank you for being here. Dr. Lindemeyer, thank you for being here. And for the committee for recognizing me. I did some preparation for coming to speak with you all today, just reading about the lineage of the Praxis Award in ethics and the criteria you use to nominate and then select. And it made me pause, actually, and reflect on these past 2 years, which I hadn't thought about it from an ethical perspective. And so I typically have, 42 slides. That's about 17 minutes to give a talk, but I thought I would rather specifically answer the questions that were posed and speak from my heart. So. The first question that was posed to me from Dr. Dorley and the team were, what are my motivations and dreams? And I would say, honestly, growing up, it was always to be a doctor. I'd like to tell you that that came about later, but I can honestly say from the time I was about 9 or 10, it was to be a doctor. And most people say, oh, because you wanted to help people, and that was part of it. But honestly, I was tired of being poor. And when we went to different health centers, the doctors that I saw there seemed happy and they seemed well put together. And I thought, well, maybe if I'm a doctor, then maybe my parents won't have to work so hard. So that was it. Then in school, I did well in math and science, and that afforded me to be part of the AT classes and MG classes, which meant I left North Philadelphia and I got to go to Drexel and I got to go to Penn, and I got to see a whole other side of the world of Philadelphia that most kids who might grow up in North Philly and West Philadelphia never get to see. And so for me, that opened doors and possibilities. And then once I got to medical school, I thought, I'm going to come back to Philadelphia and I'm going to go into primary care and I'm going to make all the communities I grew up in better. And then I got hit with surgery, and I was so challenged by it, and I had to study, and things were different every single day. And so I veered away from my first love, which was primary care, to follow my desire to be a pediatric surgeon ultimately. But then in medical school, we learned medical ethics, and we learned about social determinants of health. And I was 20-something years old and remember hearing that African Americans have the poorest outcomes for every possible disease, and that so much of it had to do with the fact that they didn't trust doctors. And I thought to myself, that's not my experience. I felt more like the healthcare system had been largely untrustworthy, and that they felt that way because of experiences that had happened and passed down. But at 20, I felt so helpless. I felt like, what can I do? I'm just a student. And I carried that with me. And so, number one, the motivation, the dream to help people to maybe not struggle as hard as my parents had to struggle. I felt like to take care of us. And the dream was to make my community better than where it was. The other question was, what challenges did I face? Well, the challenges changed during the course of the pandemic. In the beginning, it was we needed PPE, we needed tests, I needed money, and I needed staff. The other challenges were bureaucratic ways of doing things, which are you propose it, you have a meeting, you have another meeting, you have another meeting, then you vote on it, then you amend it, then something happens. And in the middle of this crisis, there was no time for the proper protocol and algorithm to saving people's lives. And so many of the decisions that I had made, so you heard I was at Abington, I operated at St. Chris, I was on staff at CHOP, best hospitals in the world. But somewhere around 2017, I decided to go into private practice so that I could spend more time with my children. Because as a surgeon, you go to work when it's dark, you come home when it's dark. And once my children were old enough to say, Mom, are you gonna be home when I wake up in the morning? I knew something had to change. And so I decided to work for myself and go to work at 9 after they had breakfast, after they were on the bus, and then I would start my workday. Little did I know that that choice that I made to work for myself would give me the infrastructure that when this happened just 5 years later, I didn't have to ask for permission. I didn't have to ask my boss, can I have more tests for this community? I didn't have to say, can I take time away from the operating room to take care of a community that needs me? I just needed to do what was right. And so, as much as we were all sheltering in place 2 years ago, last month, watching tons of CNN in our pajamas, which was what I was doing, people were calling me, because I'm born and raised in Philly, as you heard Dr. Bennett say, and saying, Ala, I think I have this COVID, but I went to the ER and they won't test me. I have the symptoms that everyone says, but they won't test me. But here's what the criteria were, and you guys remember this. You were 65 and older, you were a healthcare professional, some had traveled to China, you had chronic medical conditions, and that was how you could get this coveted test. Well, the people who were impacted that were calling me were between 30 and 50 years old, and they didn't meet that criteria. But they were face-front employees, so they were driving SEPTA buses, they were operating the trains, they were in the grocery stores, they were postal workers, they lived in some dense households where you could have a baby and a grandma and everybody in between, so they didn't check off the list that was largely created by people who didn't look like them. And because we didn't have a vaccine, all you had was a test and contact tracing. In 19132 in North Philadelphia, where the positivity rate was 1 in 3, you could not find one testing location, not one. But in more affluent neighborhoods, in Center City, you could find one every block. And so the challenge I faced, and I went through the proper protocols. I talked to the hospital where I was on staff. I talked to the mayor and the health commissioner. I talked to my senator. I talked to my congressman. And I said, people are dying. Well, yes, but we're talking about it at the next committee meeting. And yes, we're waiting for funding from the CARES Act. And I said, they need a test. And so with my practice, and I believe all of this was divine intervention, because everyone around me said, private practice as a surgeon, you'll never make it. And the first year, I didn't make any money, but I didn't expect to, right? Because I had started that, I had PPE as a surgeon. Why? Because I had a medical office and we wear masks and gloves and gowns all the time. So I had that. I had a contract with a lab company, so I had my own testing kits. And I said, I'm a doctor in good standing. You're gonna bill me for everyone who's uninsured, because the test was $50 and people were dying. And with that, we went door to door to test people, and then church to church to test people. One of the students asked me, how did you gain trust with the community so quickly? And I said, well, I purposefully called us the Black Doctors COVID19 Consortium, BDCC, because it was easy to roll off your tongue. But at the time, African Americans were dying in Philadelphia at a rate of 55 to 60% of all the deaths, but represented 44% of the population. So there was a discrepancy. And since that was the most vulnerable population, in a public health crisis, you go to the most vulnerable group. So as much as folks, and on Twitter you'll see it, that's racist medicine. Well, it's a public health crisis. And when you have that, you go to your most vulnerable population. This was the most vulnerable population. And so I wanted to, in that name, connote trust, to say that we as Black doctors are coming to you. We're not charging you, we're not asking for anything. And then you know the population you're serving. The Black church is a place of refuge, it's sanctuary, it's peace. Whether you believe in God or not, it's a place that everyone knows they can come. In fact, we also went to the mosques as well in the community. And my pastor talked to the pastors. I went online, I looked at every zip code where the positivity rate was the highest and asked my pastor to find a church in each one of those zip codes. And that's how we decided where to go. And I said to the pastors, all I need is the parking lot, electricity, and a bathroom for folks to use when we're working. And everyone opened their doors to us, and that's how we got started. And so the challenges, and I apologize, every time I talk about it, it's just emotional because it was so hard. It was so hard. And because people may have known me as a doctor in Philadelphia and as a hometown hero, they didn't know me as a public health person. They didn't know me as an advocate person. And so everyone talked around me, but not to me, to say, well, what do you need? And then after they vetted me, they were like, oh, she's just a pretty face. She'll be here today, gone tomorrow. And so they just left. And so all the support we got was from the community. It was from folks waiting in line and bringing us bottles of water, from people giving us dollars here and there, from the mothers of the church preparing meals for us. But what it also allowed is for us to become more and more independent, that we didn't have to rely on folks to make it happen. And so once people kind of said, hey, they're onto something, we could pick and choose our allies about who was most helpful to us. With the trust, the other piece of it, in addition to the name, was being present. In whatever field you are, to gain that trust is not being there for a moment in time. But in the summer of 2020, when all the testing places shut down, we were still there. We were persistent and we were proximal, meaning we went to the people. So they had enough time to look at us, to kind of sniff us out, to say, are they legitimate? And then the people became our ambassadors. She's serious. It really doesn't cost anything. It really doesn't hurt. You really will find out in a couple days. And so we were able to use that trust when it came time for the vaccination. And even then, as this is an ethical award, when it was time to get vaccines, I had to fight to get the vaccines because the narrative was that African Americans don't want to be vaccinated. So we had a small allocation for the city of Philadelphia, and it was going to all the healthcare workers, and I am a healthcare worker, but the positivity rate for the healthcare workers was like less than 5%, and for in the community, it was 25%. And so I said, we need it in these zip codes, and the city said, you can't have it because Black people don't want the vaccine and we can't waste it. And I said, if you give it to me, they will come. And so we put up a portal, and in 2 days, we had over 4,000 people sign up to get vaccinated. And it was because of the trust that we had built, that it wasn't flipping a switch. People didn't say, oh, I'm just gonna trust you because I'm Black and you're Black. No, you had to build that trust. And we were there from the beginning. And so we fought with the city, we got the vaccine, they gave us 400 doses, we gave out 400 doses. And then every day there was more and more and more. And then again, because you guys are making me think about the ethics along the way, is somewhere in February when Philly Fighting COVID, which was an organization that the city had given a contract to, that would be a challenge I would face, but there isn't enough time to talk about gender bias and racial discrimination and things like that. But they had given the contract to this organization that then went defunct, despite the fact that they were new on the market, they had no medical expertise, and did not have the trust of the communities that were hardest hit. And so when they went when they ceased to exist, all of those folks then started to come to North Philadelphia. So for all of you who are sociology or behavior majors or have any interest at all, you had to see the parking lot of Bentleys and Range Rovers and dilapidated buildings and people with cashmere sweaters and people with hoodies. I mean, everyone was meshed there together. And it was a beautiful thing until it wasn't. Because now in the community where I told you the positivity rate was the highest, there was this huge influx that took vaccine from people who had no other option, that didn't have a doctor that they could get vaccines from. There was this influx. And so again, I spoke out. I got a lot of hate mail for that too, to say, in a public health crisis, if you take from the community where the transmissibility and the positivity rate is highest to go to your community where the positivity rate is lowest, it just keeps us in this pandemic longer because it keeps spreading where it's high. And then you take the vaccine and you go back where you're working from home in your house, not exposed to anyone, but it doesn't get us to the end of the pandemic any sooner. But unfortunately, all people could see was race and not see the public health crisis in it. But then 2 weeks later, the city started oversampling the hard-hit zip codes too, so it was okay. And so there were lots of ethical dilemmas and whatnot. So the definition, Praxis, and I hear people use it a lot, but since now I have my name on an award with Praxis, the official definition, it's defined as an accepted practice or custom or an idea translated into action or something in reality rather than something in theory. So think about that. And I thought about what theory do doctors practice? And the best one that comes to mind, and I promise you, Dr. Arante Bennett and I have never met, except for today. She said, first do no harm. And so you think about physicians and healthcare professionals, and we talk about first do no harm. But that means something different to every healthcare professional. My opinion is it shouldn't mean something different, but it does mean something different. So, an example, a person comes in, they have a heart condition. As a cardiologist, I diagnose your heart condition. I write you a prescription for a medication to take every day. I've done my job, I say, okay, see you in 6 months. That doctor has done their job. But if you don't take the time to say, do you have insurance that covers this off-label medication that I've prescribed you? Do you have the funds to pay the copay to take this medication every day? Is that doing no harm if you don't ask that question? I think it's doing harm, but not every doctor feels that way. And so it's a tough place to be in medicine because any doctor you ask will say, I don't have any bias. There's not a racist bone in my body. I treat everyone the same. And in their mind, they do treat everyone the same. But that theory, if you will, is not a universal definition across all of healthcare professionals. And for me, I think how we get to that is we have an understanding that whatever you prescribe, whether it's a procedure or a medication or even behavioral therapy, that you have to see it through to the end. And in my mind, that is doing no harm, is knowing more about your patient than just their medical condition, but the environment that they're going home to, the challenges they may face that impede them being able to put forth whatever algorithm you put forth for them. That is the inclusivity and the full picture, if you will, of first doing no harm. And that is largely what I believe that I've done. And for Praxis, taking that theory into action is having a vision, having a goal, surrounding yourself with people to implement that goal, removing the folks who are blocking that goal from happening, and always knowing, in my mind, that you're doing the right thing. And the right thing in the midst of the pandemic is that we all wanted to wake up to see another day, but that the playing field wasn't level for everyone. And so my job in the pandemic was to try to level it as best I could. And then after doing that and with creating the access and the education, it was now that people's eyes are wide open to not lose the opportunity that existed to deal with all of the other health inequities that make the life expectancy different based on your zip code by 20 years. And that's where the Center for Health Equity came in to place. And so my motivation, my dream of giving back to those with less giving back to the city of Philadelphia, who knew would come from a pandemic and come to fruition, and from every decision that I've made in my life that's been through faith and my belief in God, who orders my steps and who has made this all possible. And so I thank you all from the bottom of my heart for making me look deeper at the ethical part, because I hadn't looked at there. But there were many ethical decisions that I had to make along the way that made this all possible. So thank you, Villanova. Thank you, Dr. Dorley, Father Donahue, Dr. Bennett, Dr. Niedermeyer, my family, thanks, y'all. So, Dr. Dorley, can I say one more thing? Okay, so I have to say, you guys all sit down, except for my family, except for y'all. So I have to say, when you start this thing out, right, and you have no money, you have the vision, you have the idea, the people that are gonna believe in you first and foremost are your family, right? So I'll start with Tracy and the husband that I've known since we were 8 years old in summer camp. We went to college together, we were roommates, we were initiated in the same sorority together, and helps me run my business. And so that's family. All right, y'all can sit down. Not the first, just the two I talked about. Now, my husband, I said, babe, we gotta go test people. He's like, what you mean, Ala? I said, we gotta go test people. Well, how are we gonna do that? I said, I just need you to drive the van. I just need you to drive the van. Well, where are we going? I said, babe, I just need you to drive the van. I'll give you the addresses, we'll drive the van. And from that day in March through now, 2 years later, he's been driving the van. And I mean that literally and figuratively, and just holding it down. So thanks, babe. All right, now you can sit down. Now, my mother-in-law, I'm just gonna go in order. You needed somebody to answer the phones. My practice was 4 people as a pediatric surgeon. So I call my mother-in-law, retired. I just need you to answer phones. What am I supposed to say? Just say, your test result will be back. A doctor will call you with your results. Answered the phone, still answering the phone 2 years later. Thank you. Have a seat. Now, my father, because he's been here his whole life, knows the city like the back of his hand. Every time it was time for me to go to a new church, I'd say, Daddy, what's the neighborhood like? What do I need to know? What do I need to know? And he would just come up looking around. Well, this is the block captain over here. This is the guy I went to high school with. This is who I used to work for at OIC. And so I knew the scout of wherever we were going before I got there. And then my stepmother, we were literally vaccinating at Leah Chorus. She happens to be a nurse. I said, is your license still active? All retired. Yes. I said, it's so many people out here. I need you to help draw up the vaccine. I said, what are you doing? You said, well, sweeping the floor in the kitchen. I said, she's like, well, by the time I get dressed, I said, please come. And she showed up and has been here ever since. So thank you. Have a seat. All right. Now, thank you for giving me the time. Okay. This is the original Dr. Stanford right here, Dr. Ala Stanford. Now, she is city, urban, regional planning, worked for the Commerce Department, 3 decades plus, and retired. And so now I'm dealing with all these city officials and these Congress people and senators, and I don't know who any of them are, and I'm getting frustrated. And she's like, well, that's not how you That's not the approach I would use. And because they were coming with such passion, my emails, and people saw Stanford, they all assumed it was her. So that was how it got me in the door. But again, finding the location for our center, getting the architects to put it together, our next location that will be in North Philly, Germantown, all because of your expertise and what you gave to the city of Philadelphia. So thank you for that. Thank you, thank you, thank you, thank you. Jolly, I have to say you were the first one who coined, "She is our Harriet Tubman." And I appreciated that because they're all obviously people who you revere. You don't expect to hear your name mentioned in the same name with someone so great. I never thought about it like that, ever thought about it like that. But I realized that the calling and the strength that I was getting was not from me. It was from God. And I honestly believe that for Harriet Tubman to do what she did, it had to be a higher power. So I thank you, Jolly. I thank you. And for supporting my mama. Now, Mommy, I said, Mom, I need you to rent me a van. Here's my credit card, just come get it and rent the van. I said, don't tell them what we're doing with the van. Do not tell them we have COVID supplies in the van. Just give them the credit card and tell them they can charge it for a month. That's all you gotta do. Don't tell them nothing else. And I said, I need you to answer my phones. And I need you to pray with folks when they call and their results are positive. And I guess just for all the times I said, I'm gonna be a doctor one day, I'm gonna be a doctor one day, for telling me that I could and never telling me that I couldn't. And so, how you build something, right, is your family, because they were the folks that were there before I was a CNN hero, before Congressman Evans and Boyle said, we're gonna invest money in you all for the Build Back Better, right? And so I would say, especially to all of you guys, to your students, you know, form your village, your tribe, your family to support you, your faith, whomever, whatever God you serve, to give you strength in the toughest days, and know that we all are the change that we're looking for, and it's embodied in all of us. And I love you, Mama. Thank you, Dr. Dorley, for giving me the time. All right.